Channel 5 Network, this is MorningLine with Nick Beres.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Beres here on a Wednesday. We have a good show. I'm going to invite you to join in the conversation because I think almost all of you out there have hearts. I say almost because every once in a while in this business I come across individuals that I am convinced do not have a heart. But most of us do. And if you do, you want to take care of it as best as you can. We're going to be talking about an event coming up that, the Heart Walk, the Nashville Heart Walk. We're going to promote that. And we're also going to take your calls, questions, and find the very latest on heart health with us this morning from Vanderbilt. He is a cardiologist. He really needs no introduction, but I'm going to give him one anyway. Dr. Joshua Beckman. Good morning to you, sir.
Thank you so much for having me. It's such a pleasure to be here.
I have no doubt you have a heart.
I may have to.
And I do as well. It's nice to have you on. Thanks for coming. And I was asking, that, and we're going to talk about this Heart Walk and how you can join in that. Is this Heart Care Awareness Month or National Heart Attack Month? And what did you say?
I actually said that I think every month is Heart Awareness Month.
I think, is it? Okay, which kills more people, heart attacks or cancer?
Heart attacks. Heart disease is the #1 killer, unfortunately, still.
Is it because we live such a rich lifestyle in this country?
I think that's one of the reasons. I think the way that we eat and our lack of activity, I think that we don't have to farm all day long for most of us. We don't have to walk everywhere. I think that we have great opportunities to eat whatever we want. And of course, there's some temptations like smoking.
Oh, right. Things like this. I just don't know if compared to other countries, some European, does America have a little bit more of an elevated heart disease problem than other countries?
Well, I would say in comparison to some, but we're not at the top.
Okay.
There are places in the Middle East, for example, that are worse than we are. But most of the Western countries where there's lots of food and less of a reason to exercise, heart disease is an important killer in the society.
Oh boy. Yeah, I was looking at some of the numbers that the folks from the Heart Association, who of course are involved with this, 610,000 people die of heart disease in the United States every year. That's 1 in every 4 deaths.
Yeah, about 2,100 a day.
2,100 a day. And most of those preventable?
I think that we have an opportunity to reduce that number significantly. Most, hard to know. I'm not sure I can give you an answer to that, but lots of things we do can reduce it a lot.
Yeah, that you can reduce. I mean, and there is a genetic component, I would imagine, for some folks. And that's where I want to get into more of that. But I mean, diet, exercise, clearly important. But I mean, some people are more prone, perhaps?
Yes. So unfortunately, in the same way that you get your good looks and smarts, you inherit some bad things from your parents as well. That can be an increased chance of having high blood pressure, having high cholesterol, and just having a tendency to develop atherosclerosis and heart attacks at an earlier age.
Yeah.
So yeah, that certainly happens.
All right. Well, real quick, and we'll mention this more than once, the Nashville Heart Walk. Are you going to be participating, sir?
Of course I'm participating.
Of course.
I am an active volunteer for the AHA.
I think that's awesome. American Heart Association. It's going to be September 15th at Vanderbilt University. That would be coming up here pretty quick.
Yeah, it's Saturday. You know, you can still sign up. Just go to NashvilleHeartWalk.org.
That's it. I was going to say that. It's on the screen. Look, she threw it up there. Activities start at 8 a.m. It's a heart walk, not a run. It's a celebration of life and a day of fun for everyone. Proceeds go toward research, education, and community programs. Research is my big interest. I mean, heart disease has been around forever. All right, so what's new out there right now in terms of the treatment or I guess the prevention? What have we learned more besides the standard stuff that you just talked about?
So I think that there's a couple of things that are happening.
Okay.
First, I think we're really beginning to peel back the onion of understanding the genetics of heart disease. Are we close to cures as a result of genetics? No. But I think for the first time, we're really beginning to understand how we can find people in advance and give them the therapies early and make sure they do the right lifestyle things. We're not there yet, but we're getting there. I think that the medications we have now are much better than we've ever had before. And in fact, about half the people die from heart disease now as did 20, 30, 40 years ago. So we've been making steady progress through reducing smoking, making sure that we treat cholesterol and high blood pressure, trying to get people to be more active, and then obviously applying the right medications and predicting who's at higher risk and who we can help more.
And we're completely convinced that high levels of cholesterol are a factor in heart disease.
Oh, yes.
There's no question about it. As great a factor as smoking?
I would say it's hard to weigh the exact risk because you can have variable levels of smoking. Are you a 10-pack-a-day smoker? Is your cholesterol 500?
Oh, right.
But in general, they're both really potent risk factors.
Potent risk factors. All right, let's do HIT real quick here, and I'm going to get into some. I'm going to give you myself as an example, and I invite our viewers, if they want, if they're dealing with this, to share their situation. But the risk factors for heart disease, if you would, let's go down what they are. Okay, so high cholesterol. If you happen to be a smoker, okay, what other factors would there be? Drinking, is that a factor? Sodium intake, things like that, dietary?
So obviously having diabetes is a big problem.
Okay, all right.
High blood pressure is really important. Having a family history. Eating lots of salt actually puts you at high risk for high blood pressure. That's its major problem. And obviously smoking is a terrible one as well.
Yeah.
I think those are the big ones that I would talk about.
And then lack of exercise, or I mean, exercise helps. But if you don't exercise,
yeah, we've actually learned that being sedentary is just not good for you at all. Man was not meant to be sedentary.
Yeah.
And so even the amount of time you sit during the day, if you add it up, it tells us that the more you sit, the worse it is for you. So people who are more active do better. And in fact, the Heart Association would suggest, and it would match the research, that we should get about 150 minutes of exercise a week.
Okay, that's
30 minutes of walking five times a week.
If you can do that.
That's right.
All right. And as far as body weight, is that a factor? I know plenty of people who, you look at them and they're rail thin, but they have a heart condition.
Yeah, so it can happen to people who are overweight and people who have normal weight.
Right.
People who are overweight tend to get have a greater risk of things like high cholesterol, diabetes, and high blood pressure. But it can happen to folks who are rail thin too. And so that doesn't mean if you're rail thin you can avoid seeing the doctor and getting these risk factors checked. All
right, so those are the risk factors you can be aware of when you go to the doctor and check. The warning signs for a heart attack, I guess we can go from high cholesterol as being one that's an external warning factor. What I mean by external, I mean it's early on, as opposed to suddenly having chest pains one morning, right?
Yes.
Okay, so
yes, the high cholesterol and high blood pressure tend to be there for years.
Okay.
But the warning signs you really have to pay attention to, and let's go through both heart attacks and strokes, since those are the two big killers. For heart disease or heart attack, it's chest discomfort. People don't like to call it pain because it means something, but it's burning, aching, heaviness, squeezing, tightness. It is a pressure on your chest. Sometimes it can be in your arms. Sometimes it can extend into your neck or your jaw. And if you're having a really odd sensation that is bothering you, it can even be severe indigestion, usually associated with other things. I don't want you to think if you've had Indian food and you have some kind of reflux afterwards that you're having a heart attack.
Right.
But really severe feelings that's a marker that says, if this doesn't go away in 10 to 15 minutes, I should seek some medical attention.
Most people would notice that as being something different than what they've experienced before.
I think so. I think you just have to not deny that it's a problem. Because most of us, myself included, we like to minimize symptoms we get and sort of say, this can't be a big problem. But when you have these big episodes with the chest discomfort, the tightness, the burning, you should pay attention to it.
Then there's folks like me who are kind of on the borderline hypochondriac, and I have a symptom and I assume the very worst.
Yeah, so I would say that because it's such a big problem, you should, if you feel uncomfortable, you should call. And you'll find that if you have this over and over and over again, that what you're now experiencing is not a heart attack, and you'll be able to exclude it.
Right. So that when it comes again, you're ready. All right,
that's right.
Just a good overview. What we'll do is take a break. When we come back, get into a little more detail. And I do want to open up the phone line, 737-7587. I personally am fascinated by this. Part of the reason is I think I deal with high cholesterol. I'm going to ask you some questions about that. I know many of you maybe have had doctors say statins, lifestyle changes, what's your HDL, LDL ratio. We can get into some of that. But if you have a question or comment about something along the lines of heart disease and the like, give us a call. We'll take your calls. This is a chance for you to talk to a cardiologist. And this guy seems really nice and friendly, and you put it down there where I can understand it. So, come on. here's your shot. I don't even want to think about what it costs to visit you for an hour in the doctor's office. Well, they get to do it for free today, all right? So we'll take a break, be back with your calls and more on heart health right after this.